we are bringing in the element here, the languages of the arts. Kutabe khona labahlabelako, kutabe khona labapendako, kutabe khona bosonkondlo, and what we understand about art is iyakhona kufika lapho khona mhlambe a newspaper article noma a speech would never reach. So we understand that music particularly has got a long throw. Music has got an element of repetition, and sivangati, that is exactly what we need right now. We need an element or an environment lapho khona skutana khona and lapho khona skumbutana khona start celebrate 75th anniversary of the Universal Declaration of Human Rights. So kumcoka ukuthi sikhumbutane, especially about the human rights, particularly about gender-based violence. So where we come in, or where I come in as a son, as a brother, as an uncle, I'm bringing in the voice of the male perspective. Lapho khona sithi singematfotsa. One, we're being honest. Asisho ukuthi bobabe bona bahlukumedeki. But lokumcoka sithi ke for bobabe kuze ukuthi baleleleke nathi asesilalele. For us to be heard, can we first listen and understand what the issues are, and then ngicabanga ukuthi Mfulini, you will know ukuthi historically noma ngabe bekuyi apartheid eSouth Africa, noma ngabe bekuyi slavery eAmerica, noma ngabe beku timbite emhlaba, the world wars that we have seen, it wasn't until kusukume ematfos athi kuthini asesasithanzi lesimo, asesayithanzi lendlela letimfo lethamba ngayo, we do not like the direction that the world is taking. And when men stood up and held hands in collaboration with women, in collaboration with young people, lapho khona sabona ukuthi kwabese sekwende kumehluko. So nanyalo, we are calling on that same power, we are calling on that same ability of the male in the society. Ngigo sithi masculinity is supposed to protect the vulnerability of our society, not to take advantage of it. So from ngaloko ke Mfuleni ngithi njengenvotsana njengemuntu lonelivi lelivakalako in my country, in my community, in my village, and in different parts of the world, we are coming together to say we are also standing behind sithi asekutfolakale lelikambi. We are looking for the solutions. We have seen the problems, but we are now looking for the solutions, especially from the perspective of the man.
Umthetho sowuhambe wefika lapho ufike khona njengoba ngiyamuva nje bayichaza lapha nathi sibantu kufanele siphakame nebenkosi lendle ngibone njalo nemaswathi sinayo ayibe sekhathi la ngoba sizophuma nalo lelikhambi nyalo nje bangwana ngidacela ukuthi u76073020 nisibhalele ma WhatsApp nisichaze nami ngibona ukuthi kungenteka kanjani ngaphambi kokuba siyofika kule festival nekuthi ke lokunye sidavula incingo nebenkosi lendle masijanga sekufikeni nisichaze nje nanibo babe nabo make labathi yindaba into esingayisida nasiyofika kule festival ukuthi sitonto umehluko nebenkosi lenhle kungaphinzeki lo mnyaka lesikuwo lona ube mbi kakhulu kubulewe bomake labanye ndi kakhulu bablabo babe nyalo ke sesibheke nini njengemaswati ukuthi nisiside sibabona bomake bayisebenza inzaba kodwa ke ngeke basebenze babodwana kufuna nani nibe sekhathi nathi sibe sekhathi singena njalo kwesine singumsakazo ekutheni sizohlanganisa bona nani kuze kuthi lenzaba lena ivakale kabanda ngathi made
uqinisile Mfuleni ngikhumbula nje lelinye ilanga besibitwe ngumhlonishwa DPM Thulidladla lokwangijabulisa nje sisacoca naye ngoba naye unalo moya ukuthi sicetha njani kuhlukubeta and kuyinto lekusenhlitweni yakhe la isukumele abekhuluma agcizelela ukuthi ngabe yini lo sonke silakutafuleni lesingakwenda sibambene sikhulume ngavilinye ngoba sonke kunemandla ngamunye inhlangano letehlukene nema individuals kunemandla labanawo nema traditional leaders baholi bemango lesihlala nabo le ema communities kukhona labanga ligalelo labangalifala kakutheni sicethe lokuhlukubeta lokho ke kuyajabulisana Ntulweni ngoba kusho lokuthi sonke simaswati ayisiphathi kahle lenzaba ehlukubeta and ingasiphathi kahle seyethusa seyifaka esigabeni sekuthi sesiva sisethembani so uhlala eceleni kwanithuli nombukusise ukuthi ingabe ngiphephile la noma ngidawuthi ukuthi ngisithela ngive sengijujwa intamo so leto tinto leto kwetendayela ukuthi le society noma lo mango lesiphila kuwo kungabi ngumango lapho bongafisa ukuthi umntwana akhule khona kungabi ngumango lapho umntwana afunza into lenhle khona so nasisukumile ke sikhulume ngavilinye ngilenye indlela yokuklina lo mango wethu ukuthi nathi indlela letihlelekile ngoba imithetho iyodwa angeke izishintshe abantu ikhona inzima leyidlalako lemithetho kodwa kukhona lokunye lokubita ukuthi sishintshe indlela umuntu lacabanga ngayo sishintshe indlela umuntu latibuka ngayo tinto singaze sithi awu sikholwa ekutheni sodovu khona batawuboshwa bayejele lawo majele atawukhona yini kubopha bonke labantu labakhona so besikade kukhulunywa i-report iveta ukuthi emajele enyalo bantu labanengi ugcwele abantu labahlukubetile labajajwe ngale SODV kakhulu kade bobabe so akusizo sithombe lesihle leso ngalomango lesiphila ku so thineke sifisa ukuthi yini lesingasukuma sifundzisane sibisele lithando i1 billion rising inana lokuthiwa ngama philosophy of rising one of lama principles of kusukumela kulwa nehlukubeta ithi asibeke lithando embili kuko konke lesikwendako lokusho ukuthi nasinelithando angeke ngize ngimhlukubeta umfule ngithi ngamthanza makhelwane wami ngidawumsukumela nangibona ukuthi kukhona into lengahambi kahle iphinzi ikhulumise ukuthi asipracticeeni solidarity noma kubambana ngoba ngikona kanye lokutawusenda siphumelele kuko konke lesikwendawo ngingafuni ngi1 billion rising campaign ukuthi ngidadendela ngethu ngiyamdzinga uhulumende ngiyamdzinga Ntfuleni ngiyamdzinga lo makelo lemakhaya nalo babe ngiyamdzinga babe chief ngiyadzinga inhlangano ngiyadzinga amaphoyisa ngiyadzinga inkantolo so siyadzingana sonke kulo msebenzi lo matima kangaka
ngisenze indzaba lapha kodwa ngisafuna ukubuta kugoje sokuthetha sengiyangakhola okay ya ngoba ngibe ngifuna ukubutisisa kabanti kakhulu nje mthambi tawucondzana nawe lena medem ukuthi nanibuka nele trend yale abuse ibangwe yini exactly lamakhaya sitokwathi siqonde gqoko etikwendzaba
yebo Ntfuleni lenzaba ehlukubeta dinengi letinto letinalo mthelela wayo ngitawubeka kafishane nje ngingaze ngithatha isikhathi lesithi kwekucala lokunye kungabangwa ukuthi ukhule phase simo lesinjani ukhule ubona ini kwentiwani kuwe leyo nto leyo lenteka ngabe uyahlukubeteka noma ubona lomunye uyahlukubeteka kwenta into letimbili emntwaneni kungenteka athi into lekufanele ngiyende noma abe nenzondo naloyo lo wenda leso simo leso so lo mfana ke lokhula ngilesimo lesinenzondo nalesine kwenyanya nentfukuthelo kusenekwendeka ithelele kulomunye noma so wasala sola bonke abantu kani bantu abekho kuleyo ndlela leyo lokunye kwabo kuhlupheka sikhala ngekuthi economy yakangwane ingileyo lento engandengako kuyinto lebhlungu ngoba na ubuka leliso ubuka esigabeni sekuhlukubetana uyabona lokuthi impela kusetaba madima kakhulu bantu nabahluphekile benda into ngekumangalisana lo munye uyahlukubeta ngoba frustrated ukuthi ngide nemsebenzi angathi nokuthi ngidawuphila ngani nakafika ekhaya so waba esilwane nangabe angibabe uyalwa nangangumuntu wesifazane so uyawumukela netinto letingakafanele ukuthi atimukele so uganile lana ngokuthi ubuka ukuthi awuzama akhona ekuphila ngako lokho kungilokunye nako lokubhebhetelako lelizinga lehlukubeta lelenda nebantu bathi noma ngabe babona ukuthi bayahlukubeta bangasuki kulesimo leso achubeke soluhleti la ekuhlukubetekene lokunye lokubhebhetela ngulendlela lesikhuliseke ngayo indlela lesibuka ngayo umuntu wesilisa nemuntu wesifazane so le socialization nabasho njalo ngesingisi bokhethe zibatayiva le patriarchal lengaso sonke isikhathi iphakamisa umuntu wesilisa yehlisa umuntu wesifazane ifika ke lasigabeni lapho noma ngabe sekune tigaba lapho kufanele singabe siyavikelana kunalokubuka nje ukuthi umfati uyashaywa unongamshaya umfati ngeke azabe ngumfati kahle nalo mfati uthi kukahle vele babe angishaya nalo mfana ukhuliswa wathi ukuthi yena unemandla etikwe emfesifazane kungako ke utasinakathi uyamala ukhiphi okap uyamgwaza nakathi sekunento lasevangasa angavumelani ngayo sebayabulalana ngoba lo wesilisa ukhuliseke ukuthi wena unemandla etikwe umuntu wesifazane utathi noma samnikele imali yekuta uyabona entulini labakhuluma ngayo ngiyathi kahle ngingayiva le indzaba imali yekuta asinakamnikile nangabe angakakhona ukufika sothi utambulalela lokutha akafiki ngoba yena wathi ukuthi unemandla etikwe umuntu wesifazane ngita ishwamba kanye nje ngiyibeke ngalo dine ngakhulu letintfo umfula ngathi bala letibhebhetela lesimo lesi
wena khathesi njengendoda yebo umsengathatha kodwa sokwajola esikolweni nakuphi yini lebanga ukuthi imbangela ukuthi ugcina umshayelo umuntu wesifazane
No, ngicabanga ukuthi a lot of the issues nabula saka senzile makahlatshwa is especially around le socialization. Dining tinvo lesikhule stifunza ngikutibona and le kude lo fike wasikhuta noma wasikhombisa the other side, the other way that things can be. And that's exactly why as part of the 1 Billion Rising movement and the 1 Billion Rising Festival, we are going to be painting the picture of what the future can look like. Nasibambisene, and what the future can look like if ematfota atata the position of being protectors and caretakers of their family and of their community. And that is why kumcoka lokuthi sihlangane sikhulumisane ngale ndzaba. Xolani also touched on the fact that one of the main pillars or one main principles is the principle or the pillar of love, and that's exactly what we're going to be emphasizing on. So dawubona nje ukuthi even during the festival tingoma letabehlatshelwa tinkondlo even not the arts that is going to be displayed on the day is the one that is bringing us back together. Sasiphume la kule ndzaba ukuthi bobabe versus bomage. We need to look at it from the position yokuthi bobabe na bomage versus the issue. Asesihlangane sime on one side sine collectively and be the ones that are fighting the issue. Ndawubekisa ngana indzaba yaseBhayibheli endvuleni ngoba ngiyathi cha iBhayibheli incwadi lo very familiar with indzaba ya Noah.
Awuyaya
indzaba ya Noah. So bonke labantu batibona letikhukhula balibona litulu yena wakumkhulu. In the middle of the problem he came up with a solution. So right now Sonkhe sayibona lenkinga. So as the 1 Billion Rising Festival and as the 1 Billion Rising Movement, all we are saying is sayibona lenkinga. Siyabona letikhukhula, siyalibona litulu nalita ngemandla, but can we come up with a solution, and a solution that is going to be safe for all of us and not just for one or the other. And that's exactly why ngitsi la kuqaleni we are taking the position yokuthi asesiyekele ukuthi it's men versus women. It's men and women versus the issue.
People and places akafamise ukuthi ivumele konke nikusho ivamise wena bese ibuka ngale ndlela ufuna bengayo ngoba thina as ma journalists sibantu stressed ikhanda lendzaba sibitwa kuqala nje lapha ezulwini South Africa sababe kuqala nje nakusenza kwenteka tonke icishe lendawo sibakhona esikhathi esiningi kuvamisa kubambeka make babe akhanza make mhlamba sesimeni lesikabi mhlamba kwenye eve wayibona njengaleyo. So ngicabanga ukuthi ngasesikhweleni tikwalendzaba lokuthi babamba labo make babangwa yini lokusibende njengoba nathi nawo lamadoda agaha angithi yabona but bomake bona abawabulali angithi yabona nje but emadoda nasathola wona sekunenkinga lenje bese kuba ne problem ufuna ke sikhweleti kwendzaba leyo mnemedemo mhlambe wena ngeke sokuyati kahle sihle courtesy emadoda bangwa yini babangwa yini wena medemo bangwa yini bomake lokusibese senifuna kuphumela eceleni.
ngicabanga ukuthi mvuleni bonke abantu ngabe ngimake ngabe ngibabe banawo ema weaknesses abo labanawo le kungilapho siyathinga lokho siyikhulumise vele kungako sihle sasibiyele negumeni asibe sibiyele emasangweni nasisho njalo ukuthi asikhulumisane nisi-address le issue lenye lesiyibonayo ukuthi uyathi as much as sithi bomake bayahlukubeteka kepha kunento noma umkhuba lesubona abachubeka bawenda asiukhulumise njengoba nasibona bobabe bawenda so ngeke sithi wendiwa yini umuntu ukuthi athane indvodza yakhe agane lenye indvodza lokunye kunengi letinto letikhona lomunye kungaba ukuthi kuyihabit yakhe nje ukuthi uyathanza kuba na multiple partners noma kuba nabantu abanengi lathandzana naye lomunye mhlambe kukhona lokushoda kule relationship ukuthi mhlawumbe nakushaya inkonzo yase abantu labadzala umthandazo uhamba ungafiki lapho kufanele ukuthi ufike khona lo khanza ukuthi so uthi ke asengiphume ngiyofuna lapho lo mthandazo uze kufike ku-amen khona lokunye kungaba ukuthi kunale mpilo lengasiyo kahle lakhaya le menda lo muntu because you know when uku relationship lede lithando lede kukunika ukuthi utibone ukuthi nawe ungumuntu uyahlonipheka uyanikwa sigaba sakho ukuthi ungimake noma ungibabe na unganikwa lento leyo kushoda lokho lomunye ugcina aphumela ayokufuna ngaphandle another thing le inkulu kakhulu communication kubantu laba relationship ingabe bathathene noma abakathathani sekuthi communication labantu laba abakhulumi express ukuthi utiva kanjani ngabe lokwenda kokusho ini kimi lo munye usinakathi uyafuna ukuthi expressa noma uyasho ukuthi uva kanjani lo munye sosho ukuthi ukuvephi ukwatelaphi so kuba bethe lokukhulumisana lokwenda ke ukuthi ngoba akukhulunyiswana ugcina lomunye ayofuna ukukhuluma engcenye kani asakhuluma lengcenye sewukhanzotholwa ngemangce so yadleka lehlane so ngiletinye tinto lekufanele ukuthi sitibuke letenda lokuthi kuchubeka kube khona lokuba munyu lokukhona kuma relationship lokungasho ukuthi ngithi kwento abo make kuphela nabo babe bayakwenda kepha sidinga lokuthi sibuke lokuthi nangabe siku relationship nangabe kukhona umuntu la kwendako nangabe siyambona nje ukuthi icolani sophumile sohamba yohlala emakoneni phela lo babe akakhe decision is either silala phansi siyakhulumisana ukuthi angiyithanzi lento le or I make a decision ukuthi I move out from the relationship ngoba lokuchubeka sisebenzisa na ingcondo lesikhuliswe ngayo ukuthi you have power and ownership over women ngiyo lele kwenta ungakhi lesinqumo sokuthi uyathi le ntombi yangigwadlela ungathi yathi le lo muntu lona akakethembeki uchubeka solo ufuna ukufaka ingalo entweni loyibonako ukuthi iyawulimata umoya wakho so the best thing ukufuna ukuthi na ukubona nje ukuthi uyathi lana ngathi akusebenteki la chubeka uyofuna letinye intombi noma ngabe ngumfati uyamiyekela idivorce ikhona nangeSiswati siyacinywa certificate aqhubeke umuntu nawe uthi chubekele kuze kunganto uba khona nasimo lapho sekubulawana khona sekucinzetelana khona kunalenye into nje enthuleni lengifuna kuyi-highlighter indzaba yokuthi bantu labanye labahlukubetako nalabangafuni labahlala banalomona kunabantu lokuthiwa ngathini bane low self esteem lo uthi ngaso sonke isikhathi le ndvodza ngidasi nje nangenza eceni kwalenye indvodza ithi yangibingelela awu sengilele nayo akusinje kuphela i-low self esteem banalo hlobo lokuhlukubeta lohlala akusola kuphekehla nje ukuthi wena kukhona into loyendako nabani ngoba yena akatethembi ukuthi nakasithele ngale koneni kusho kukhona la vela akwenda so leto tinto leto ngiletinye lefuna sitikhulumise ukuthi sisakhulumisa labantwana kungako the platform ye festival is so inhle kakhulu ngekuthi iletha bonke iletha maki iletha babe iletha umfana nentombazane iletha umfana lo ngumfana lapho batawuthola khona ukuthi bafundziseke ku-environment lemnanzi latawufunza lokuhle ukuthi ngisakhula nje ngumfana naku lengingakufunza lokuhle nangibona intombatane ngingakhula ngibe indvodza le kanjani
ngathi ngiyakubonga kakhulu ngibele bese ngifuna ufaka umbuzo so phendule kagcineni kuthi the festival tawufana abantwana ngoba phela kuthi indlela sikhuliswe bomake sonke because ama families ethu are dysfunctional kude bobaba umsebenzi wababa siwathi mbamba ukuthi uyini utithola sowukhona lapha nje uyayibona njengaleyo lokunye nje madam mhlambe ngivile indzaba yakho uyichazeke indzaba naye ukuthi umhamba afika agcine endlebeni uyabona kubalekile madam nalapha ekutheni kube nendlela elikhambi uyabona ukuthi utawusitakala njani baba ukuthi amise ekhaya angithayibona njengaleyo ukhathi ukuthi mhlambe netimbita baba emakhaya ngibathinze babe khona le festival batosho ucoca nayi le mhlophe le uyinatha kabili uyinatha kathathu uyabona njengaleyo mhlambe nako ngihamba kusite wena madam ngoba inkinga ilapho wena madam indzaba asipheleli thina baba siyawelwa ngale nduku nasethi le nduku makangasho abese uyesuka yena so ukhuluma ngathi I love you sweetie kanjani kanzi seyinkinga le uyabona maka asayiva ngakangitshele ke Jamini kwekuqala lokho madam kwesibili nayo into ofana ni address angathi bafundise imbathinzile yini sungamkami bakubone it's like kuhle konke lokukhona emshadweni bayasachaza lama problems futhi abekho abafundisi ngalesikhathi sekufika isigaba se divorce abasangena anto ayibona njengale bafakeni ngena bona kule festival uyayibona njengale kwesibili futhi nabafundisi bachazelwe kabantu ukuthi lapha kuna into la ebathi counseling bafundiswa indabantu uyabona ukuthi kwentiwa njani le ngishito ngaphambi kwesingene lapha ngathi mina ngibela 6 wema-tapes engasala nawo ngicana i-channel S kwathi koyichama ama-productions nangithi ngimixa le-cassette lemshado kulomnye lapha mixe ngale nangithi wangibangine-deposit ngifuna le-balance ama-balance azange sengiwathole ngibamba le-tape ke mina ngabamba zabangisikise ngabasento ngengisebendelele one babe i-90 ufike walala ubuthongo le honeymoon number 2 make kuqhanzakale sohambe kakhulu uyayibona njengaleyo dinenge letinkinga leti bahlangana nato but ayitewa ngabafundisi le so nalele bible ngathi alifundwa kahle ngoba kunanathi incwadi ngiziteka nathi iBhayibheli kunathi incwadi takhisha namaroma niyasola silenza bilapho ngoba phela lo no sex before marriage ngiyabona bayi-addressa le kubomakhabhisi letingathi letho ngoba onke lama divorce abangona inkinga naye angathi ukuthi ndathi kanganani noma wadelana waphela
cha
kodwa lo ukuvesibani
yabona ke so ukhipha lapho kumbe uzomjika ematini cha yabona Mfuleni kahle and vele in terms of the way we are approaching this ngiko sibambisene ngoba njengoba makahlatshwa kashito la kucaleni ukuthi sifuna kuthi kude loyo naloyo who is an expert in their area so that we get lama solutions abe complete kungabi nje isolution ukuthi Thamsanqa ucabangani noma Xolani ucabangani noma Mfuleni ucabangani but lama solutions akabe complete and lama solutions akachamge from the areas and the people where the problems are ngoba sengenganaka especially kulama areas abo social behavior change management siyabitana sithi asambene Hilton sibitane sibeng 10 sithi hey majana inkinga sicabanga ukuthi itawucatulula kanjani kube ngithi nje sisodvana sichamke ne solution sisinasicetha sithathe le solution sihambe soyifaka kubantu kanti as understand lokuthi yini lenkinga on the ground ngawubekisa nje ngawubekisa ngevo lelula nje ngema overhead bridge yafika engineer afike ayithathe abuke yena ngicabanga kwakhe athi hayi itaba yinhle nangiyifaka la kanti labantu lekufanele ngibo labayisebenzise bathi tsine kudvute esitolo ngala so nawufake le overhead bridge lapha ayisebenzeli tsine ngiko solo sichubeka solo umgwaqo siwelela la so ngiko sithi if we're going to have a solutions lataba nesipho tawufanele sikhulumise labantu who are on the ground which is what i1 Billion Rising is doing. I1 Billion Rising ingena kubantu and we are getting the problems and we are getting lama suggestions of lama solutions from the people who are affected. And that is why I love le suggestion yako yokuthi asibabite the traditionalist, asilbite lisonvo, asilbite uhulumende, asilbite the artists, the people who are constantly standing up in front of people and speaking. Are you giving them hope? Are you giving them healing, or are you giving them solutions that are going to be real and practical for the thinking? So I definitely in full support of the idea would see, can we make the solutions abe practical and the solutions abe complete and abe inclusive?
Nhlene sivusela ngiyathi ukuthi nama families bantwana bala ngaphandle nje 76073020 usabeka amademba asishaya.
Ngiyabonga Ntfulini lokuthi avele sitawuvama kuda ngoba egcineni kwako konke inhloso yethu sifisa lonke eLeswati bosomabhizinisi tinkampane letehlukahlukene netinhlangano letingekho kophansi kwaHulumende ukuthi siyacela abasukume basibambise. Siyafisa ukuthi lo msebenzi lona ube nguloyo lo tawuthinza lonke eLeswati ngetinhlanga othitalo lapho bakhona khona. And njengoba nje ulicobile batawube khona nabalicobe kanje ngoba what makes Eswatini unique, it's our culture. Singilokhu lesingiko sivele sihluke nje nasemaveni. So siyakhuthaza nje ukuthi lo msebenzi lona siusukumele sonke. Nasithi ke uyasukumela ngalesinye isikhathi asisho ukuthi usukumele ngokuthi utawuletha imali kuphela. Lo munye usukuma ukuthi uthi mina ngalelanga lokutabe kwendeka le ndawo bengikhona nithi labangena elayinini babheka ngakuphi ngicela kusebenza into volunteer. That's the spirit ngoba sifuna lokho lokuthi sonke sisukumile kukhona inzima lesidlalako. Labanye banema platforms la tawuhambisa lo mlayeto bayawusukuma bathi hayi sebenzisana nayo indlela yethu. Labanye ke babe nale kusichasa ngetimali ngoba mkhulu lo msebenzi le moto yakho nje nayi yalendasi ngicabanga abo diesel noma abo petrol ukuthi ngabe live yawumbambisa njani Ntfulini lo sukumile nje wathi ngifuna ukuthi nana ngilongeka afike lena kodwa asiyative letinkulumo asibone lesimo ukuthi sinhlekani nalama artists lati khandlile lashite ngiyaya siwalekelela njani ngoba ayomix umlayeto lesiudzingako silive.
Sokhona sakhona icingweni nona samuele hle sawubona. Yebo sawubona Nkosi.
Mina ngiyabonga manje ungene lapho. Ngiyayiva le nkulumo lephuma kumake lapho yaleja. Yebo ma.
Lalela Nkosi manje lapha bamfana bangisabasi sebazivulela. Awuqhubeke Nkosi silalela. Hello?
Yebo ma.
Sesiyakuva ngosikhuluma nabantu kuphi?
Ukhuluma nabantu basilela eMatha.
Yebo Masilela.
Yebo ngeke. Le ndaba amamba lekhuluma ko inkulu kakhulu.
Yebo
mama. Indaba lebandi nalitsha lapho ngobe impilo leziphila emhlabeni namuhla isafana nempilo entombi.
Yebo.
Kwanze nje kubulalana ngiyo le ndaba nginikhuluma ko Ntuli.
Yebo.
Indlela ekuphila nyalo ngaba kuhle njalo mkhuluma mamba ukuthi abafundisi nabe bashadisa balikhuluma leqinisa.
Yebo.
Ngoba isikhathi lesiningi lenkinga isuka la ekudabisaneni make nababe. Ukhanda ukuthi abantu bayathathana Ntulini abatshani lempilo yabo. Imali nababa batshani nabantu abangena ushadweni ukuthi banjani base bahleli kanye seyavela la inkinga ukuthi mhlawumbe ngalapha kubaba kusalungile upho. So yasuka lo msindo Ntulini.
Iqiniso.
Uphinde futhi ukhande ukuthi labantu abafune ukukhuluma leqiniso asho nje mhlawumbe kuloma ukuthi nje manje yenginkinga lendlela nje impilweni yami semanizwameni kanje uyayibinda le ndaba isihle. Nyamuhlomanje ukuthi ukhanza ukuthi indoda seyisola lo muntu lo mfathi wayo ukuthi sambona ngiyakhulunyiswa umuntu ngoba yena wathi ukuthi khona la ngakwenzi kahle lapho sothi abasebasomana lapho. Ngicabanga ukuthi empoleni malunga kahle kuvela amaqiniso akhulunywe kahle laba abafaka labafundisi lapha kule counseling babeke bonke impilo inje yabo nje ufuna ngibonelane lapha nalapha nalapha. Ngiyabonga mama.
Siyabonga kakhulu. Angathi ngibalo uzakumphendula.
Umuntu ngoba baba usho uyakhuthata lokho lesisolo sikusho. Ngiko nje singumkhankaso njengoba shida khethes ukuthi siba sebantwini sinetigungu lesinato emangweni lapho sicocisana khona and lokuhle kuleti gungu ngoba tisemangweni kunemasondo lamangweni senda siqiniseko sokuthi imasondo baholi bemasondo sibafaka ekhathi njengebaholi bemimango. Lo shothi bobandla kancane nabaholi bemasondo siyacocisana nabo ngoba la kusho kungiko kuliqiniso ukuthi ingabe lana sesibemukelo ngoba yona samaningi lamasondo and amanengi nje sekude lesikhathi sekubuka lokuthi nalona losothi uyamshadisa namuhla ingabe akasiyeni umfathi noma indodza emuntu ngoba ngente kasitatela labanye bagijima basotobalekela ngalana ubaleka ngoba uyathi ukuthi ushiyeni lemuntu nakafika lana yena so yashada sengikona lokho sekunengi nje lokutatela ikwenteni intindvo kungaba ngilokukhuthaza nje ukuthi emabandla njengoba sisebenzisana nawo lahlukahlukene futhi sitawamema sitabe sinawo lamanye kule festival siyakhuthaza sinalabanye labasivako bethe ngetinombolo tabo ukuthi senda njani ukuthi njengoba kulisondo kuyindzawo wonke umuntu labalekela kuyo kude umflotha kakhona noma ungaya kubabe emakhanya kodwa udava umfukoja mkhonda kuphi lo sho ukuthi siyaya ngala kodwa kukhona nalapho sikhona kakhona so ukuthi lapho ke seluswe khona ukuthi elibandla lenda njani lento esiqiniseko sokuthi liyayakha le family unit noma le structure ngoba nangabe umfuna kaoshada kukhulunyiswe ebandleni lo sho ukuthi linemthwalo lomkhulu ukuthi lapho kwakhiwa khona le live kahle kahle likhaya lakhiwa emndenini so nakucalwa lo mndeni libandla ke linemsebenzi ukuthi labantu laba siba introduce kanjani kulendo nekuthi noma bangena kulomshado ba understand ukuthi akusumshado wanga 1975 sengumshado wanga 2023 nalabantu sebakhuluma lenye language sebafike ba exposed kuletinye tinto so uyawukhanja ukuthi indodza lengithishela futhi sengibala kakhulu thishela indodza lesebenta lengisecurity guard itaba nemfati longidokotela so sengilesikhathi lesesiphila kiso nyalo sekusho ukuthi sokufuna lo mfa understand ukuthi sokuphila nebantu laba kanjani lokunye sethi nengaletifo sesigula kadzeni bekuncane lokugula ukhanza ukuthi umntwana ana 12 years udiabetic naka 12 years utaba ngumfati nomntaba indodza yemuntu kunema implications konke lokho so tonke leto dinto leto libandla liyathinga lokuthi lisibambise kakhulu kuloko.
Siyabonga kakhulu ngicela sake sivalelisa Khethes.
Yes no phinze sibonge kakhulu mfundini ndawutsinza nje info lesitsinzela la ngephandle nasesemile ngehlelweni information ukuthi ngathi kakhulu incumbi yabantu sebajabuliswa ngule wedding kanti i-wedding is just the beginning of the marriage.
Exactly.
And ngilona lo uva ngathi ngoba njengoba sesho ukuthi sese 2023 sichaza lo stifombe behle Facebook ku-Instagram bengifaka isudu make afake veil noma ke besivunulile sibahle kunjeya kanti inkinga ukuthi we are not ready for the actual marriage or the journey that we are going into. And that is part of lama conversation leswakhuthatako in the spaces tsineke sebenza kakhulu in the spaces yebantu labasha. So in the youth workshops, in the youth seminars, in the youth conversations lesba now, those are some of the conversations nasekamcoka ukuthi sibe nawo. But on top of that, we're just encouraging Stanza Kutsata Sive Yemaswati ukuthi kunayi movement na umsebenzi omkhulu we 1 billion rising siyanemema siyacela ukuthi sibambisane so that we start to build a different culture and a different future of Eswatini, especially in the space of the relationship between a man and a woman, in peace, in harmony, in unity. Njengoba ngisho ukuthi sifuna ukucetha lendaba ukuthi kube sesebangathi it's men versus women, asikho lawo. It's men and women against the issues, against the injustice, and against the things let is bambela emuva letingas women ukuthi sikhule sichubekele empini. So siyanemema ke Maswati lamahle on the 24th of February 2024 sibe silapha eMavuso Trade Center ukuthi siphelele ngetingani. We're going to be having conversations, we're going to be having sessions lapho khona we're going to be encouraging healing ngoba siya understand and fully ukuthi ngesingezi kuthiwa hurt people. So we are saying can we have a conversation lapho khona we are going to be producing healed people so that healed people can heal people and we heal our land in its entirety. So isho kanjalo i-1 billion rising festival.
Siyabonga kakhulu wayiteka le ndaba ye-wedding nemshado nyalo sebashana kwesitungu ledala ngathi lephumla bathutha ngiyaguquka tende nje. Bese sebaswaba sebajiva kufanana ke lapho ke. Bacabanga lokho nje labantu.
Bacabanga lokho nje. Umshado
akusiko lo. Uvalelisa manje.
Siyabonga kakhulu Mthulini, sibonga lelithuba and siyathembisa kumbukele ekhaya ukuthi ngemvumo yaNthulini sitawuchubeka sibe sita sitococisana. Sita nalamanye ama partners noma labasekela bahlabeleli labasekela lo mbono lona ngoba egcineni ngokonke sifuna live la kangwane liphile ngekuthula sikude simfuna kumbona hlukubedekile ngoba umkhankaso awuhambisani nekubandlulula noma ngekubukela labanye phasi sithi nje bomake nabo babe nebantu labasha abaphile eveni lelinekuthula nalapho bonke bahloniphana khona kube betelidlama.
Yebo kakhulu manje. Singakaphumi nje ke noko sovalelisa. Awuvalelisa. Uvalelisa manje.
Siyabonga kumbukele ekhaya. Sibonge kakhulu nalo mvo losochamukile nje kubabe. Ngulo losikhombisa ukuthi umsebenzi uyendeka. Sibonge kakhulu Maswati lamahle nibe nebusuku lobuhle.
Siyabonga kakhulu. Khetesi lapha bakwathi labantu laba ngoba igama la Khetesi ngasilehlabela bafuna kuva ukuthi iproject yakho lesoyisebenza ngoliphi bakuve nje kancane so ukwente le mvamisa kwenta ngive futhi ubita le igama la February lapha uyathi ubita kale indlela oluvile angimado February wakhe ukujikisana ukuthi udosa la lwimi ngasho ngathi no angikwadi ke lo asovuthele kunye ngesive lapha.
No lady. Cha. Mina nembhobho. Siyinhlandi nemali. Ngeke sosihlukanise. Sihlanganiswe kumbeli nchandi. Uthando solo luvutha ngathi sicale kuthandi. Awuthi sengibamba umoya bese ngithi ngidlalela kabani. Lenzaba lena mina ngayibona ngisakhula man. Kuthi mina ngibhukusha ngiphambana nemfula man. Bangani bamisele ngokuba mapansula man, bangicanisula man ngoba mina ngumrapper sana. Nangifike endzaweni bekukhalabo yo man ngisho nasekhaya uve when you gonna grow man, let go man, get a suit and tie and make some dough man. Ngashaya ingoma bathi yo you got a flow man, lokuviwa inhlitiyo yami ngeke ngikuyekele. The best you can do is ukuthi ungisekele. Ngifuna kwathi umhlaba jikelele ukuthi vele ke mina nalo bhobho siphelele.
Ayishane. Wayivuthele. Umhlaka bani kodwa mhlaka
24
ndawuva lokunenge benkosi lento sithi lo mbhobho wenda njalo uhamba ufike noma kanjani benkosi lenhle asibonga kakhulu zazethu usisilethele majala njena lokukhanya si uyathi le talent lamba umbuta nyalo uyasuka uyayenda akafuni besola ufunza incwadzini kanjani into esibafunako lento ila kangwane ngoba empeleni cha ukuthi esibili madam sothembe udaphinda usakhele futhi elinye ithuba njengoba ushintsho wasidathu usivusela nje sito uphakamisa lo sibantu badi lokuthi utawuhamba kanjani yebo kakhulu cha nebenkosi lehle people and places already yaqhubeka lapha bosovalisile kwethu
cha bese ngibhalisele sibonge kakhulu Mfulini sibonge kakhulu channel Yemaswati sibonge kakhulu Esven seMaswati sisabambisana kuna umsebenzi lomkhulu nibe nesuku lolu
siyabonga kakhulu benkosi lehle channel people and places yaqhubeka la njoba siyethemba sinani ndasibambise kakhulu nje ke ebashito lapha ukuthi 1 billion rising ifuna isito lehlukehlukene indawo lehlukene benkosi lehle losho sindini bathi nje obviously la 1 billion rising inombolo ethi
it is 7926 79269383
79269383 nebenkosi lehle nabe nawo ufuna ukuthi ujeke just vivaneni kakhulu kulo msebenzi otaba ungiple nyanga kodwa awubasho nje so ngita lo wethu unini lojabu February bazi 24 February utamhla 24 February ngenkosi lenhle noma kanjani sesembe sinawo nabe kusawuphumeleli utayibukela ku channel Yemaswati kodwa nabe yaphumelela kunene noma njani fika lapho ubamba khona kuze kuthi buti wakho mako wakho anti wakho angafi nebenkosi lenhla bulawe nginasimo lesibhekene live la kangwane sethembe noma kanjani labeni nathi nebenkosi lenhla lomsebenzi loyo nekuthi ndasibambisa nje ngaphambili bekuyofika kuwo lo msebenzi lo nibambise bona be 1 billion rising nebenkosi lenhla ke iyaqhubeka lapha people and places kodwa kwanyalo sake sisigqiye emakethe masibuya nebenkosi lenhla sesibuya nabo laba be TLC nisale kahle.
Satiso sekuvala lihhovisi ibhodi baphathi netisebenti telidlela mvongeni bayanifisela kanye nemindeni yenu emaholide akhisimusi lanekuthula kutfokota nalaphephile neminyaka lomusha lonempumelelo lidlela mvongeni ENPF latisa sive nalabo labathintekako ukuthi yatobe avaliwe onke emahhovisi alo kusukela mhla tingemashumi kuyo inyanga lesetulu yengongoni eminyakeni wa 2023 kuze kuvulwe mhla tisiphohlongo kubhimbidvane eminyakeni wa 2024 sive siyatiswa ukuthi ticelo letiphuthumako temali yemngcwabo titawemukelwa ehhovisi lelikhulu lakamanzini litovulwa kuze kube ngu-12 emini mhla tingu-27 na 29 kuyo ingongoni eminyakeni wa 2023 namhla ka-3 na 5 kuye bhimbidvane eminyakeni wa 2024 kanti simemetelo sikhishwa libandla lelidlela mvongeni.
Whose fruits are these anyway? Wait a minute, okay I get it. Live for today but prepare for the future. Make sure you cover your wealth.
Umnyango weticishamlilo even leMaswati Eswatini National Fire and Emergency Services.
Sayifisela sive seMaswati khisimusi lomuhle nalophephile. Silwa nemililo lengalawuleki, siphephisa impilo tebantfu kanye nekuvikeleka kwetakhiwo. eMaswati lafise ukuxhumana nawo umnyango weticishamlilo even leMaswati angashayela inombolo enhlaba mkhosi lemahala lethi 933.
Yendi imsebenzi lemihle lesingayisho le yakhiwe yendiwa ngiyo iLook Commission lesingakusho nje ukuthi namuhla njoba silapha sonke sidodumisa nekubahalalisa emsebenzini yonke nemitamo labayendako unakelela eMaswati kakhulu njoba siyeva ukuthi noma asafikilela konke uphuma ungakabhadali ngisho senti lapha kuyabonakala nangembala singasho sibili ukuthi laba lebe balapha bebavele bathunywe uNkulunkulu ngoba ubona nangale tendo letendeka khona lapha kokutheni wendiwe imisebenzi leminyenti njoba lapha sekwakhicitwa oxygen kwenteka lokwana lokwa nekwekusho ukuthi le look commission miracle namuhla kusukela namuhla seyivele ibusisiwe ngekwemsetho ebekunayo.
Your Majesty, I speak today not for myself or for the Luke Commission, but for the most isolated and underserved populations of our kingdom, those with the least access to care and treatment. We believe that all solutions for a thriving Eswatini are already in Eswatini, are in the hearts of our people, our Yemaswati. We believe that compassion is a limitless resource in a resource-limited world.
Livila lamuhla litfolakala kuTaga 9 verse 10. Kwesaba simakadze kusi
Honorable guests, honorable members, order, all protocols observed.
Hey, open up and enjoy it.
A shake on food can change the mood. Aromat. Open up unbelievable flavor.
Lehlweni lapho sesikhona people and places. Lo mhlaka ehlelweni lebenkosi lenhle lapha sitawunjinjanitsha kancane sisikhuluma lesingisi bekunene ngalo sisesine Luke Commission lapha enebenkosi lenhle senginaye lapha long director of operations lapha babembonga Tsenithela bese ngitoba namake Nomsa hey lesibonga lesifana
Vanderwall.
Wonderful. Just show yena bekunene lesibongo sakhe lapha ukuthi kuhamba kanjani. Ngeke lebenkosi lenhle lo executive director wakhona mshelo wa Luke Commission. Well, viewers, just as I mentioned earlier, we're with the officials from Luke Commission. We all know that they've had many strides in the Kingdom of Eswatini. There's just so much good that has happened in the Kingdom of Eswatini due to Luke Commission. Well, there's just been so many changes and rearrangements that have happened over the years, and especially a few weeks ago. So we'll be addressing all those matters right now. But in the meantime, let me have them introduce themselves. I'll start with the Executive Director.
Thank you, Babe, for having us. My name is Echo Vanderwall, or Nomsa Vanderwall, and we're really glad to be with you tonight. Thank you.
Yes, and Director of Operations.
We are very honored to be here again today. Yes, as you mentioned, my name is Nkoyoyo.
Yes, now tell me more about Luke Commission first, because this is the first time you're appearing on Channel Yemaswati.
Sorry, Babe, let me apologize first that it's taken so long to come here, but
yes.
My husband and I came to Eswatini in 2004. When we were children, we were called by God to work overseas. God specifically told us Africa in healthcare. And we didn't know what that looked like, because when I was 8 years old, I felt that call from God, and when he was 17. Then we met when we were 19, we married when we were 21, and then we moved to Eswatini in 2005 with our children. And so when we first came, someone took us out to a community by the name of Timbutini. And when we got there, we saw people in their houses, and they really seemed like they needed health care, because at the time was the height of the HIV crisis. And so we felt that God was calling us to work in the rural areas. So for the first 8 years that we were in Eswatini, we worked with a small team of about 12 people. My husband is a doctor, a specialist in 2 specialties, internal medicine and pediatrics. And my background is in surgery and pediatrics. And we used to travel around to every Tinkundla. We know every chiefdom. I always say I have dust on my feet from every Tinkundla in the nation, and it was just such a blessed time where we learned so much. We were schooled in the rural areas, and it's just been a blessing to be able to progress since then. And obviously, you know, things have changed a lot, but those were our beginning days when we were just working in the rural areas.
Yes. Now let's talk about the operations. Actually, I went there, and it's a very high standard. And the way we were received, I don't know whether we call it triage, is out of this world. Tell me, how did you achieve this?
Yeah, as Mage has already shared, that Luke Commission started way back.
Yes.
Luke Commission has been doing a lot of work in the operation site, including the outreaches, even the outpatients, as you have mentioning. So the unique part of it is that we work as a team. There is a teamwork amongst the team that we are working with. Part of what we have achieved in the teamwork side, we have a base camp class whereby we are doing an induction process just to start knowing how Luke Commission operates. It's when we are getting the positive attitude from the patients, from the staff, because our motive is just to treat our patients as our own brother, mother, father, father or sister. So that's how we are seeing everyone showing compassionate when it comes to the patient care. So even if you're getting at the gate, you have to get the same love throughout the process until you get your medication.
Yeah, but let's talk about the technology. When you get there, everybody is on a computer, and tell me more.
Okay, Baba. Well, I appreciate the fact that Mbungseni started with compassion, because for us, the approach to healthcare, and really anything that we do in life, is the manner of approach we feel needs to start with compassion. And I'll go back to our time in the rural areas in Eswatini when we first came, that we were asking the patients, why are you not going to the hospital to get help? And they said that sometimes they felt stigmatized, and then they would say to us, if we have to be treated like that, we want to go home and die. And that really shocked me, because I said, oh, it's because people don't feel love. They need love first. So I would say even the technology, which is something you can see with your eyes. The love you don't see with your eyes, you feel it. Yeah. But the technology was just born out of how do we develop a system that can provide the highest quality health care at the lowest possible cost. And the technology helps us to stretch our resources, and it also helps us to maintain accountability and transparency and integrity in our operations, of which in the last year we've treated 300,000 people in Eswatini, which is a lot. And in order to do that, the technology helps to propel the efficiency of the system. And so I think all of us have gotten really excited about it, because about 7 years ago we started building this digital ecosystem, which you're talking about. And now it's this, when we first started, we were just doing this to solve what we thought were small problems. Initially, the first module we built was actually a scheduling module, because we found out if we had the right people at the right place at the right time doing the right thing, we solved 80% of the problems. And then if we add supply chain and have the right commodities, you almost have 100% equation for success. And I like to say that the digital system programs us to succeed for the patient. And so over the years, we've just continued to build applications, one application after another. Sorry, Bobby. You need to go to the hospital.
Yeah, definitely.
So we've just built one application after another, and now it's much bigger than what we ever anticipated, but we're really excited about it as well.
Yes, and 300,000 patients a year, 15,000 a day. Now, I believe that you are having problems. Let's go straight to it. What's happening now?
Thank you, Tulini. It's very shaming, and it's so saddening that we have downsized the number of days that we are working because of the problems that we are facing. All along, TLC has been known to be 24/7 in the operation site, just to work with every patient, seeing every patient. But now, due to the issues that we are facing, we have already downscaled the number of operation days, and we have already informed the patients about the days that we are working. And Mage will elaborate more on that part, and it's something that is very sad. And in terms of going just to turn the patient back, it's something that hasn't happened in the past over the 18 years the commission has been operating.
Yes, and then why did you downscale?
Well, Babe, things have been difficult, I would say, for the last 3 years. And it's, on one hand, you're so grateful to be serving the nation, and from the heart, we want to take care of everyone, and we want them to get a high-quality healthcare service. But starting about 3 years ago, the number of patients who were coming who desired healthcare at TLC was far outpacing the amount of resources that we had. And we have tried over the last 3 years through various engagements to try to match that, because there's a big gap, there's a big mismatch, and we've tried in so many ways that I can be here till tomorrow if we talk about all the things that we've tried to do in order to avoid what we're talking about right now. It's very painful. More than the word painful, because our heart is with the people. And as Mbongiseni said, we are a hospital. Hospitals are supposed to be open 24 hours a day, 7 days a week, 365 days a year. Sickness never chooses time of day or what day it decides to affect a person. And so we've been really, it's been very difficult. I'll be honest with you, the tears are flowing a lot. Because, as Mbongiseni said, in 18 years, we've never ever said no to a patient. We've never ever turned a patient away, no matter what time they come, no matter the circumstance that they have. You'll remember even during COVID, we never turned anyone away. And we feel that that's what God has mandated us to do. But unfortunately, because we were not able to find a solution, we had no choice but to start downscaling the number of days that we're operating. Additionally to that, and something that we've never done up until this point, is to lay off staff. We had to last week lay off staff between the non-contract renewals that just naturally expired and the people who were laid off. It was 160 people. We are a team of 700. It's very painful. And yeah, something that I've never done in my life before, and I never ever want to do it again. It's very painful, Bobby, to talk about these things, because we've really tried, taken all kinds of measures that we knew, had as many engagements as possible, and unfortunately there's just not a solution on the table. And sadly, even in the downscaling, it's not enough. There will be more that we have to do, because without a solution on the table, we just cannot continue to take care of so many people. And it's difficult because your heart's in one place, but the business reality is in another place. And so I know there's nothing that I can say to make this okay. Today, I was at the hospital, both inpatient and outpatient. There were so many, and you just wonder, like, where will that go? It's really hard. I won't lie to you. It's very difficult. It's been very painful.
I do understand exactly what is the problem. Why did you get into this situation?
I'll try my best to be respectful about it, because our heart is one of full respect, and we don't ever want to betray anyone or any institution. But unfortunately, we were just not included in, especially the international donor pool opportunities for health. And that started during COVID, where we just were not put in those budgets or those proposals. And at the same time, the number of people that were coming to TLC for service and choosing TLC every day continued to climb. At the same time, we haven't lost we haven't lost donors at all. They have been very faithful over the last 18 years, and they're still faithful. But as the number of people increased, the donations to offset that number of people didn't increase. And to be frank with you, there's a lot that has happened in the last 3 years that has never really been probably even understood by the nation. The patient who gets the care, they understand, but a true presentation of what role TLC is playing in the healthcare sector has not really been acknowledged up until this point. And without that acknowledgement, you just said this is the first time we've sat down in 18 years. And one of the reasons is because we've never, we really felt when God called us here, we weren't coming here for anyone to say good job, we were working for God. And then at some point we realized by excluding the press that we're actually making a mistake. You can't take care of 300,000 people a year and exclude the press. So we're trying to correct that, and we're not getting it 100%, but I'm really grateful that the press has been sensitive and cautious with the situation, because more than anything we want peace to be maintained in the nation, even though we know that once you touch on healthcare, if you withdraw healthcare from a person, it can really make them feel even more vulnerable than maybe they felt before. And so we're sensitive to all of those things happening, but I would say that this mismatch started really widening during COVID. And it's unfortunate because there was millions of Emulangeni that was available to the country for COVID, but TLC did not have access to it. At the same time, we, as you know, built the oxygen plant, and it saved thousands of lives, and it changed the outcomes in the third wave. And you know, we had so much less death during the third wave because of that oxygen plant, but unfortunately it wasn't really embraced. And so I'm sitting here worried that I'm saying too much. On the flip side, I'm trying to be genuine with you and genuine with the nation. I really want everyone who calls TLC their hospital of choice to know that we love you. We're heartbroken. I never ever thought it could get to this point, and we've really done everything in our power. There's really nothing left. We have taken out mortgages, we've taken out overdrafts. My husband and I have used our retirements. There's just like nothing left. And so if you, what I would really like to say is that we're really left with no choice but to take drastic measures. And I'm praying that this is short term, but at the moment, yeah, I can't obviously promise that at all.
Okay, but just recently I saw a visit by the cabinet minister, the health minister. He was there, and also I had the opportunity of having an interview with the principal secretary in the Ministry of Health, who was very positive about assisting TLC. What is happening from the government side?
Okay. No, thank you, Babe, for raising that, because the PS, since he came into office, has been he has engaged with us very quickly, and we're very grateful for that. And his heart is, you know, really for the people. And if the people want TLC, he wants TLC. You know, I can put it that way. I wouldn't say that he so much is a fan of TLC, but he's a fan of people getting the health care that they want. And so I know that he has a lot to try to address, and we are very grateful that he's engaged and that we're dialoguing, because the discussions, they start to heal you. It's been a long time since there's been that open dialogue that we really needed in order to be able to journey the way that we should in the healthcare sector. And then we're very grateful last week that the Minister of Health joined us or came to the campus to tour. We had a lovely visit, and it was very encouraging. It's just that, you know, you're talking about a 3 to 5 year mismatch in resources vis-a-vis the number of people that are asking for the service. And so obviously we don't have the expectation they can turn that around overnight, but we're very grateful for the engagement. We're very grateful for the visits, and we're just really grateful that we can have someone to call. You know, when you want to discuss something, it's just to have that open door is a real blessing. So I would say then we see light in the tunnel, but we're still in the tunnel.
Yeah, maybe if I can steal some of the terms from the area of medicine. This is, it needs ambulatory care. It's an emergency.
It needs an ambulance.
It needs an ambulance.
And a ventilator.
Definitely. How much do you need with immediate effect? Don't look at her. You're the director of operations.
Maybe I wouldn't be very good with the figures, but yeah, I'm looking at her because she has the answer.
Yes. All right. Yeah, what's the answer?
We need, just for an emergency, just to mitigate and build a bridge to the future, a minimum of 10 million a month.
A minimum of 10 million a month. Mm-hmm. Okay, but if you're saying a month, that's not an emergency. That's permanent. I mean, right now, as we are talking right now, to save the lives of the people and also to save the work of the people who have been laid off.
You're putting me on the spot, and I don't mind that. But what I'm saying is, if we had 10 million this month, we'll be in full operations.
Yes, and then also back to.
It doesn't mean that next month we won't need, because the recurring cost. But that's the deficit. We've been running at a deficit for a very long time. In fact, as I'm sitting with you today, we're at the bottom of our overdraft.
Okay, now, you had earlier said that somebody decided to ignore you on the donors list. Who did that?
If you can just, Babe, please
Rephrase,
rephrase. Don't make me name names, because I want solutions, and looking in the past is hard to find solutions.
Yeah, but in order for us to get a solution, we have to get to the past. You know, we need to find out exactly who messed this one up, because here we're talking about 300,000 lives. Personally, the reason why I went there because of my brother. He was actually assisted right there, and we never paid a cent. Actually, instead, what happened was we were given money. You get my point? So, to me, this is kind of personal. So, I won't miss my words. I'll ask you the question. Just please give me the answer. Who did this?
The former administration, to be honest with you, was not, for some reason, and we've tried for years to figure out why. What did we do? I've asked that question so many times. Can you please tell us what we've done to not be in the good graces with the Ministry of Health, if I can put it that way? And I never got an answer to that. And I asked because we don't have anything in writing that told us what are we supposed to correct, what are we supposed to change so that we can be part of the team. Because Imbongsteni started with teamwork. It's not just teamwork within TLC, it's teamwork within the whole health sector that's going to allow us to achieve His Majesty's goals for the country. And unfortunately, that teamwork was not there. And I don't know why, because honestly, Babi, during COVID, we responded to everything we're asked to do. During civil unrest, we were deploying all over the country. We were evacuating hospitals, moving the patients to TLC, taking oxygen around the country. Like, we really did. We built a digital system for the COVID vaccination program. We really tried to do everything we were asked to do quietly, without fanfare, without hand clap. But unfortunately, those things were not acknowledged at national level, and that just pushed us further and further in a position that wasn't healthy when it comes to the financial side.
Yes, it's the former administration you're talking about, but right now, what is this administration saying?
I do believe that everyone's looking for a solution. I feel that this administration is genuine about that. It's hard because, you know, any government, a big ship, you know, and it's difficult to turn a ship quickly. And so that's how we view it. Even, we're a team of 700, and turning that ship is difficult. How much more so is it for government, and not just the Eswatini government, but every government in the globe. So we do understand those limitations. I'm just really sad that it took us to the point that we are saying no to patients, because the whole team is heartbroken over it. It's not just me, I can tell you now, because we have been programmed and designed to help people when they need help. We want to be there, we want to help them. And to extract that from the equation is like ripping your heart out, and it's not me standing alone. I can say that the entire team is in pain.
All right, to the Director of Operations right now, how much more time do we have until the ship sinks?
Already the ship is sinking, so the car is out of fuel. So the downscaling is part of the sinking, as you could tell by now, like no waiting time until it's completely sink. As of now, the car is out of fuel. We are longing and hoping that we will be back in full operation. As you have mentioned, I remember earlier on, that you have good testimony about your brother who got assisted, and now we're going to be closing as of tomorrow, the 22nd, until the 7th of January. So we are not aware what the future predicts for us, but we're hoping and we are praying that everything is calm, the solution comes up, and then so that we can be fully going back to full operation.
What do you mean closing?
So we're going to be closing on the outpatient side, and we're going to be still having the patients in the inpatient side. So for the 22nd of December, which is tomorrow. We will be closing and until the 7th of January. So this is something that is painful for the patients, like we have mentioned earlier on, that we have already downscaled the number of days that we are seeing the patients. For now, in this period, we will be pausing just to see the outpatients, and it's something that is very sad for the patients.
Well, let's talk about the influx. Now, we're closing tomorrow, and then how's the demand for the services?
The demand's very high because the first thing that we did is we went down to 3 days a week at the campus, but then we also have the Matsapa site. So what we did, we tried to structure it that either Matsapa or the campus was open. So people at least had a choice to go one or the other. And I can tell you on Monday, we took care of 900 people at the 2 sites. On Tuesday, it was 700 just at the campus. And today, it will break those records, I'm sure, because there was a lot of people there. We'll get the report now around 1 a.m. Those reports will start coming into our phone from that system that you were talking about. No, you can't, there's no way you can make this okay. I can't, you can't, Bongsani can't. It's not okay.
Well, now, what about having people to pay?
We've discussed that, and it's not that we're opposed to people paying, but we are opposed to the most vulnerable paying. People that do not have an income, we do not want to charge them for health care. But now you're talking about seeing 900 people a day. How do you figure out who can pay and who cannot pay? It's difficult to have an objective way to say, okay, I'm going to pay 60%, you're going to pay 80%, and Bongseni is going to pay 40%, for instance. So we have discussed with government if it might be possible, and I hope that this conversation moves, because it would allow us then to have some kind of objective way to say, should someone pay 0%, 20%, 40%, 60%, 80%? We have discussed with ERS possibly an API from the system to reference the tax records. Obviously, there's a lot of discussion that has to go into that. But I'll be honest with you, Babe, to charge the poorest of the poor will be to sell our soul. Because we came here, and as I told you at the beginning, we spent our first 8 years in rural communities. We never worked in urban spaces. And we know that if you charge the most vulnerable for health care, then the people who can afford will pay, and those who cannot will stay home and die. And so we really want to find a solution that mitigates charging the most vulnerable.
Yeah, I'm looking at the press statement that you issued. Here you're saying that you're going to close outpatient services, limit Miracle Campus outpatient, limit Matsapa Clinic, continue funded programs. What do you mean?
So there are certain, I'll make an example that if we get restricted funding, so if someone gives us funding to buy 10 of these, we can't buy 100 of these.
Okay.
And we do audits, international audits every year. Those audits cost us about 500,000 actually. They're very strict. When they come in, they see when the donor gave you money for 10 of these, that you didn't divert that in any way. So now we do have certain programming that is funded. We'll continue that. The way we plan on, because then how do you find the people who qualify for that? That's one of the benefits of the digital system, is we use SMSs to communicate with the patient. So we'll invite them on certain days to come via SMS.
Well, we are talking to a lot of viewers right now, and some of them may want to assist. How can they do that?
If they would like to assist, they can, what's the best number, Bobby? The hotline number they can call, 7613-8814, or they can write us at info@lukecommission.org, info @lukecommission.org.
But I believe here we need a long-lasting solution, and I believe during the deliberations with government right now, during the visits by the minister and the PS, they might have intimated on something that they are willing to do under the circumstances. What did the government say right now?
Well, one of the discussions was around TLC becoming a parastatal, and that really is not going to be a solution for us because our constitution does not allow us to become a parastatal. Additionally, you brought it up yourself, we do a lot of technology work and we do a lot of innovation work. So maintaining that innovation hub, technology advancement space, at the same time doing healthcare, you need a very specialized team, which has taken 18 years to build that team. So, you know, it will be important to retain that team if we're going to continue doing the things that we've been working on. So unfortunately right now, from what we've been told, there's really not another mechanism. We are hoping that we may be able to look at some of the mechanisms that are being used in other parts of Africa, because really the subventions are not being used anymore. It's not 2023's solution. Those solutions are usually public-private partnerships or performance-based models, where, for instance, you agree that, you know, if you do echocardiogram, you're going to be reimbursed 200 Emalangeni. I'm using an example. More like other service providers are, say, if someone is contracted to build a road, it doesn't become that company doesn't become a parastatal now to build the road. We are looking for that kind of partnership where we can be a service provider to government.
All right, and then I believe you also gave them the ideas, and then what do they say about them?
Well, I think they're open to anything and they're willing to put anything on the table. It's just, again, back to, you know, the way that governments in the whole world function. It takes time, especially to introduce any kind of new, type of new agreements will take time, because obviously there's legislation involved. So, you know, I think there is some hope that once Parliament is back in session, that we'll be able to move forward some of the ideas that have been put on the table. But we did have a very good open discussion with the Minister of PS.
Yes, no, I do understand right now that it's an open discussion, as you are saying, that they have their own suggestions of a parastatal, but you do feel that maybe that's completely out in terms of the technology and everything else. But can't you get some common ground at some point?
I'm sure we will. I mean, it's just been a short period of time since the new administration's been in, and unfortunately, the challenges with TLC were quite advanced when they came in. So I also don't want to have the expectation of them that they can just fix everything, and I don't have that expectation of them. And I understand it's just very difficult to balance with the service provision side and withdrawal of service provision.
All right, maybe in the meantime I shall take a commercial break. When we come back, maybe we'll have some of the patients, because obviously they're watching right now, so that they can call as well and tell us how do they feel about what's currently happening at TLC. Well, this is People and Places. My name is Mamba, and we shall be back after the message from the commercial department.
yendiwa ngiyo i-Look Commission lesingakusho nje ukuthi namuhla njoba silapha sonke sidodumisa nekubahalalisa emsebentini yonke nemitamo labayendako unakelela eMaswati kakhulu njoba siyeva nokuthi noma asafikilela konke uphuma ungakabhadali ngisho senti lapha kuyabonakala nangembala singasho sibili ukuthi laba lebeba lapha bebavele bathunywe uNkulunkulu, ngoba ubona nangale tendo letendeka khona lapha kwekutheni wendiwe imisebenzi leminyenti njoba lapha sekwakhicithwa oxygen kwenteka lokwa nalokwa nekwekusho ukuthi le Look Commission miracle namuhla kusukela namuhla seyivele ibusisiwe ngekwemthetho ebekunene.
Your Majesty, I speak today not for myself or for the Look Commission, but for the most isolated and underserved populations of our kingdom, those with the least access to care and treatment. We believe that all solutions for a thriving Eswatini are already in Eswatini, are in the hearts of our people, our Yemaswati. We believe that compassion is a limitless resource in a resource-limited world.
Title of the program is People and Places. My name is Nkoyoyo. Well, we're talking about TLC. Well, there's so much that we spoke about earlier, but right now I think we should address ourselves on the positives. Well, just recently you were watching, it must have been on Friday, that was a gospel music festival that I watched, and I realized that those guys are very good in terms of TV as well, TV mixing, production and everything. And then also when I reached that place and I realized that no, they are beyond this world in terms of the setup. When you arrive, there's communication between the wards, and actually I think the ICU as well, I must address that issue. The ICU is also out of this world. I don't know how the medical terms, I wouldn't want to get into medical terms much, but what I saw there was something that I haven't seen. I've been to hospitals. I've been to National Taiwan University Hospital. I've been to Johannesburg. I've been to the US. But what I saw in the Kingdom of Swaziland was completely different, was completely out of this world. And then also I saw about snake bites. They talk about that. And also, but above all this, I've just seen some of the cutaways that we're running right now about His Majesty the King. I'm sure you met with His Majesty, and how was the meeting with him?
It was wonderful, and we're so grateful after 18 years of serving in the nation to finally have the opportunity to meet our father. It was too long, but we're very grateful when we were finally able to meet, and then he was able to come to the Miracle Campus. It was a great day, like a wonderful day, and the staff were so grateful. So many patients came, so many community members came, so it was just a wonderful day, and we're really, really, really grateful for that. I know now we're struggling, but this is one of the things we look back on the year and say that God blessed us that day, that His Majesty and Her Majesty came to the campus. But let me not say everything. Imbong Seni?
Yeah, we were so grateful, and we have got a lot of things that are highlights of the year. As we can talk about the visit of the King, and a good part of it, we enjoyed to be with him during the dinner as well, to be together and just to spend the time with us, having those activities, just dancing with him. Like, it was very funny, and we enjoyed to be with our father.
Yeah. Now talk about the innovations now. There's just so much happening there. Also an oxygen plant.
Yeah, there's a lot happening. I'm really sad to talk about the sad things, but on the flip side, there's a lot happening. And some of these, as I mentioned, are funded programs. So these are things that we're going to continue to push. Believe me, to the nation of Eswatini, we'll never give up dreaming for the nation. We have so many things that we're working on. Some of them you've seen, some of them you haven't seen. We'll be coming back maybe to talk about those, but we're really excited about the digital ecosystem. As we mentioned, when we first started, we were just working on a very small platform for us, and then over the years people started coming from every continent except Antarctica, and they wanted to look at the system. They also want to look at the oxygen plant, but what I love most when they come to visit from overseas, they always want to talk about the staff, because they're so impressed by the way that the staff take care of each other and take care of the patients. But the digital ecosystem, 2 years ago, we decided to re-platform it on a very big platform that can manage millions of simultaneous users. So one of the things we're working on in the background is to drive that out so it can become a social enterprise, which means we're trying to generate income to try to bring in revenue for the operations of TLC. Obviously, this is a massive project, and but we are in some of the final stages. So we're praying that we'll be able to move that into enterprise stage very soon. Also, as you've probably seen, because we did announce to the nation a couple of weeks ago that we're adding drones to the innovations. What really drove this, Babe, was the snake bites. Because I can I can tell you what happened last year. Last year we admitted 255 snake bite victims, and 60% of those were referred from other facilities in the country. 40% came direct to us. We did not lose one patient, and there was no loss of limbs, so no hands or feet were lost. That is a massive victory for the country and success, and much of that is because of the collaboration with the other facilities, because we have stocked anti-venom now for the last 7 years, never run out, and so the quick response by which the other facilities refer to us is what is allowing us to have such great outcomes. But there were 9 people that died before they made it to the hospital. So now we're looking at those cases. How do we stop those deaths? And one of the things that drones does is it ensures that critical medications are at exactly the right place at exactly the right time. So we've been working with the Civil Aviation Authority, and we have approval from them. We're still working on the training. We're training 5 local pilots in Eswatini, and we're just so excited because in January we plan to launch and start to fly medication from one site to another depending on where it's needed. And so yeah, we're really excited about that. Maybe we'll have to come down to see it on the first day we start to take forward flights. We've done hover flights on the campus so far. We will be taking forward flights now in January. It can carry 3 kgs in its payload, so it's a lot of medication, especially when someone needs the medication now. The really awesome thing is we can get to any place in Eswatini in 45 minutes, and 75% of the country can be reached in 30 minutes. That is amazing. To be able to take anti-venom from here, say, to Matsanjeni, what might take you over 2 hours by road, we'll be able to take it in about 30 to 40 minutes. So this will bring, will save a lot of lives, because and also it eliminates the need to be traveling on the road. But the other thing that's really cool is we're installing solar there. We are working on renewable energy projects. Our goal is to become energy dependent by 2025. We're really working hard on that, and we do have some dedicated funding or restricted funding for that moving into the new year. And so those drone batteries are going to be charged on solar, so they have the 0 carbon footprint. And so we're excited about that. And then what else have I forgot? There's so many exciting things.
We were very excited for recently we have done an exercise of distributing devices across the 59 Tingudla, giving all the patients wheelchairs, walking sticks and crutches. It was an amazing work that TLC did across the nation, and everyone was like amazed just to see us going around, and you could tell when you reach to the communities that a lot of people are in need of the devices, like especially the wheelchairs, the crutches, and everything. So, and even in the past, we have done a hip replacement for our patients, and now we've done a call out for eye patients, for those who are in need of they are looking for the eye problem, so that they can come, because we will be having specialists in January. So as I've mentioned earlier on, that on the 7th of January, when we reopen, patients can call us on the hotline just to let them know what next. But all in all, they have to come for the assessment before the specialist come.
I also saw on your statement you're talking about PEPFAR, USAID. Any message to them of appreciation?
It's difficult, Babe, to talk about that one, because they've been so loyal and so faithful over so many years. It's been 12 years that we've been working together, and to be very frank with you, they've been so close to us, even journeying through this, even though it's difficult for all of us, including them. We're really, really grateful for the support that we've gotten from PEPFAR and USAID, and that support is unwavering. Even moving into the future, it has remained very steady, and so we're really grateful for that, because that does allow us to continue some of the programs that are funded through PEPFAR.
Who's the brains behind TLC? Is it you or your husband?
I hope it's God.
Okay, no, God is very busy right now dealing with issues of war. Right now, I'm sure there's a war in Ukraine and right now in Israel as well. No, let him get busy wherever he is. Let's talk about us right now.
Oh, I don't know. Maybe I can let Sani take that one.
Yes, please answer that one. Who's the brains behind this? Because, I mean, looking at what you've just mentioned right now, I mean, it's something completely different from what I heard. I mean, sending drones with medication 30 minutes into the country, that's something different. And also, I also wanted to ask you, but why don't you talk about this, all this? Now, you're talking about donations, but it's not on Channel S. There's 600,000 people watching me right now. There's 2 million views currently. But why don't you talk to us?
Okay, we'll correct that, Babi.
Will you?
Yes, we will. We promise.
I hope so. Yes, please answer.
So my quote that I can give is just whenever you lift up your eyes to the mountain, God. You said we mustn't touch God because He's busy right now. But if you lift up your eyes up to the Lord, He do wonders. And when you are not giving up in doing everything, God will do wonders. So everything behind the scene is done by God. That's what I could tell.
Okay, Mr. Taylor, who is the brains behind TLC, between the wife or the husband? That's the question.
I will say it's the team. I will go back to the word the team.
The husband's name is Tim.
The team, the corporation of the team. Yeah.
All right.
I will answer maybe. I'll help you, Bobby. We believe in teamwork.
Okay.
We don't believe we're anything by ourselves. So, you can have a lot of great ideas, but if you don't have people who love those ideas and are willing to run towards those goals, those ideas don't mean anything. So it definitely, what he says about team is really true. My husband is a quiet guy, but he's very supportive and very even. He's like the center, if he keeps things centered, maybe if I can put it that way. I've always been a strange person, even since I was a kid. When I was a kid, I never wanted to play. I always wanted to work. I love to work, so much love to work, and God gives me visions that don't make sense, to be honest with you, but once you start moving towards them, they start to become reality. But again, those visions wouldn't mean anything if it wasn't for a team that's sold out to whatever it takes to bring a higher quality service at a lower cost. So those are the things we're always working on. How do we get the highest quality service? We want first world healthcare in Eswatini, but we also know that we need to maintain a low cost. So those are the things that we work together on. But what I love is that I'm able to throw big ideas out, and then there's a team that's willing to break those down into component actions. Because big ideas, without technical people who can carry those out, without a team that is committed to the work that has to be done to operationalize those, they're just ideas. They don't mean anything.
I just got the answer right now. You throw the big ideas to the team, right? That's what you said.
Well, I would say we all throw ideas. We all throw ideas. But maybe it's just because, even the way that it started when I sat on the front row of a church service and God said, you're going to go overseas and work in Africa when you grow up. Hey, people used to ask me, what are you going to do when you grow up? And then when I would tell them, they would laugh at me. Mm-hmm. But I didn't mind they laughed at me. Because I knew what God called me to, I could have never dreamed to work on a team like this. It has been just an unbelievable ride. When I look at Sani, he's been with the organization for 10 years. It's a long time. And we've done a lot together, and we have a lot more we're going to do together. And I believe that these challenges that we're facing right now, I do believe that there's going to be a solution, and I pray that solution comes quickly, because every patient that we have to say no to is one more stab in the heart, to be honest with you. But between now and then, we're going to continue dreaming, and we're going to continue pushing on those things in the background. There are some big things we'll tell you about soon.
Yeah, actually, the last time when we had a meeting with the media, the Editors Forum, I saw your children were actually serving us the youngest one also was very busy, and I learned something out of that. And today I brought mine as well here, inspired by yourself.
Well, she's the one that was taking care of us. She was really sweet.
Yeah, exactly, exactly. Well, yeah, your last words, sir. It's almost time right now.
For my side, I will appreciate the time given, and we are saying thank you, and we are praying for the Yemaswati just to have a good Christmas and just to cross over to the new year 2024 well blessed. And as for now, we are dancing for the Ingwala, for every Yemaswati. I'm encouraging every Yemaswati just to join the big event just for the dance. And as for the Yemaswati, to keep on praying for the Look Commission, as we have seen that they've chosen Look Commission to be their facility of choice, and we are praying for God to give us provision moving forward and everything just to continue as normal.
I see.
Babe, thank you, and just to everyone who's been listening and watching, we love you, and we are asking for prayers, as Mbongisani said, that we will follow God's will and make sure that we honor Him even in the tough times. I've told the team that our character is measured by how we are during the tough times, and so we really pray that we'll honor God and will honor the nation of Eswatini during this time. We pray that peace will prevail, and we just thank you for allowing us to be here. Sorry we're novices because we were used to working, not talking, to not being on talk shows. So maybe next time we'll do a little bit better. But thanks a lot for having us here. We appreciate your support and the support of the press. They've really helped us because we really wanted things to be peaceful even during these transitions that are very difficult for us. And I feel like your objective and genuine presentation of the situation has really helped to keep things calm. So thank you very much. You've taken people who never talked to you had us talk, and it's gone okay. So thank you for that. Yeah.
You're welcome. But before we close the program, let's sign a virtual memorandum of understanding that you are going to give us news right now. That was my signature, virtual signature. And, are you really going to do it this time? I've just signed.
Sign what? For what news am I going to give you?
The things that we are doing, the positive things that you do.
We will, Bobby. We
Definitely.
Will. Yes.
Okay.
Yeah, we will. Don't worry.
I see.
We've changed.
You've changed.
You know, you always have to learn and grow.
Okay.
This is an area that we didn't grow very well in, so we're trying to fix our mistakes.
Yes,
so.
to tell the viewers when I started to ask you to come here.
I told him no.
I see. All right. Well, viewers, I do believe that you did enjoy watching this interview with the TLC, and I also very much hope that God will be with us in this hard times. 160 people being laid off, and also about 300,000 a year that are going to suffer, and 15,000 people a day suffering. I think even the authorities must think about this, and then everyone else should also unite and ensure that we do assist the TLC in whichever way we possibly can. Just as I said that I took my brother there, and even my mother went there, so I'm sure all your relatives have also been to TLC, and then they've also assisted so many. Look at the history of snakebite victims. Look at what they are doing right now. Look at the innovations. And also let me express my profound appreciation to the funders currently, and I hope and pray that whoever else within government wants to assist, please do it immediately, because indeed this one needs ambulatory care, as we mentioned earlier. Well, nebengoslenhle nebengwazi ligama lami ngichawe mamba bekunene sengishaya umoya kulesikhathi sengikhuluma Swati ke nyalo. Sethembe sinjabulile kuba nathi la kulolu hlelo lapha sikhona People and Places. Kanti lapha e-studio nebengoslenhle lesikhathi nyalo sibamselela lapha Julisa kaMamba longena ahlanganisa tinzambo, bese kuba nacebile wakantshangase nebengoslenhle longena naye ahlanganisa tinzambo mshalo wa. Kanti ukhona nebengoslenhle lapha siyabonga wakadlamini bekunene lapha longena ahlanganisa tinzambo temsindvo, bese kusimshalo wa sengiphindze ngibona yena nebengoslenhle la abongile mabuza nebengoslenhle abavama kuba khona lesikhathi labantu laba, kodwa bakhona ngoba namhla kune TLC, bese kuba khona nebengoslenhle lapha temkhathi wakamamba ngumsa wami ke lo kanjalo futhi nebenkosi lenhlaphinze abe khona lapha phendla wakamamba lesinabo kulesikhasalana ngethemba siphatha uphamisa sandla nabe kusothi khona le ngumshile kepha ke nebenkosi lenhle mabe sikuphoqile siyaxolisa kakhulu mabe njalo ujabulile sijabule nawe lapha ku channel yemaswati nebenkosi lenhle ke nebendlovu yemhlaba lo mangceveza khwesho wabhuza lo ngcevete umhlaba wehlane kubevela kube simunye ngeshare ligaba zidabhuza ligitsela phaka lobamba wasukundla mphika umthethwa wayawubukela sinova kude ngikhanya abamkhaza kuma umhlabathi ngani besuke baqanqabala bayathi ndabakhanze khona nami ngayifaka uJobo libheke etulu vulgede lo kubehla siqeza sililo wathi gidza indlovu nesinayo kwindlovukazi inkosi indlovukazi mhlekazi amthathe mfana kithi athathe silo
bayethe wena phakathi wena ngangezintaba umqombo nyama esibanda engani utheseka wethula sengwayo tibiyoni wevakala sikhombeni sikathi le nyama isemnandi ekuphekeni ngani yoba mnandi ekoseni khula tholele nyathi khula ndlaliselwa khula ndlamadoda athi mbimbe njalo kwetindiza tembutho esathini defense force etule sibhakabhakeni sakangwane tindize netinyonto kangwane tihalalisele kukhula kwelive ukhulile Mswati iminyaka lengu55 akube kuhle nemfulweni kangwane kuvakale inhloko mekhalalisela lona live akube kuhle wena wekunene boya wekutala kamdlulu wasebe iqala ke ingoma elisekwane nemambala ingaja yase yamtuntuzela umntwana yase yamtuntuzela ngangezwe isho seyikhuphuka ngenhlokomo lapha etule esikhaleni selisekwane inhlokomo lethi yavakala nalapha endasenhlambeni ngimatatasela nanga nemaqhawela salala elive lapha endasembanana evakala yahalalisa ngikukhulakela kangwane ngikhula kwengwenyama bayahalalisa bofonono awekutala kwaDuba bayahalalisa nabo maphefu akube kuhle wena wekunene akube kuhle eqathazi labhuza